I do want to talk about oral health in the construct of what leads to poor oral health. We talked about evolutionary biology, kind of the genetic component of that, which can lead to the orthodontic issues. But what really in today's society is the biggest catalyst for poor oral health?
Okay, the biggest catalyst, and let's just talk about the basic fundamentals of oral health, is just lack of maintenance. Okay, if you don't wash your hair, it's going to get greasy. Okay, I don't care who you are, it's going to get greasy. If you don't take a bath, you're going to have a lot of oils in your body, and there's going to be odors that come out of that eventually at some point. Okay, and the mouth is no different. It just needs a little maintenance. And the maintenance can be very rudimentary, as it was in, before toothbrushes, because the first toothbrush was a finger, you just kind of like clean things off. So oral health and just keeping plaque, which is film that will build up on the teeth from the saliva. So, because the makeup of the saliva can be unique to your oral health issues. Okay, there's enzymes, there's food products, there's all kinds of things that can be in that plaque that will adhere to the tooth. And that, if it stays there for, let's say, 24, 48 hours, that now becomes a home for pathogens, or sometimes the bad bacteria in the body. Okay, so odors for any part of the body, odors are bacteria. Okay, let's just get right down to the fundamental of it. That they're producing a byproduct. That byproduct is what they excrete. Okay, and it doesn't smell good. Okay, so I don't know of anything that excretes something that probably smells too good, unless it's perfume. So that is what happens in the mouth. If it leaves there long, if it stays in there long enough, short period of time, you're okay. It will then, the bacteria will start to produce the byproduct that can be acidic. Okay, it can be basic, but it's generally acidic, and that will begin to cause gingival inflammation, periodontal problems, or it can cause carious lesions, which is it starts to attack the tooth. Now, you feed that with sugar, okay, or a carbohydrate that breaks down very simply in the mouth, okay, just under the enzymes of the mouth. It doesn't have to go into the digestive system. You get a carbohydrate or a sugar of any sort, and it now lives in there. It is just it's a fuel monster for these things, and then you can accelerate. That's why soft drinks are not so good. Okay, I've had my times of enjoying them. I don't do. I don't know if you guys can see. I drink a gallon of water a day. Okay, and that. I'm not going to say it's a miracle cure. It's one of the greatest things for just maintaining weight, just keeping your body just replenished with hydration and working so well. It's the simplest weight mechanism program, I think, on earth. Okay, can't sell it because there's nothing to sell. You can just go get some water and do that. But that needs to be there. Now, if that plaque stays long enough, it will harden and become calculus. Now, I'm not talking about math. I'm talking about I'm talking about a hard material, and you can't brush that off. So if you get into that space, you then have to go and have that removed by a dental hygienist or a healthcare professional.
That's the scraping that we all go through every 6 months.
Oral healthcare. That scraping is for stains. Okay, I'm a fan of red wine. I'm a fan of coffee, and since I live in hot Texas, I'm a fan of iced tea. So all of those stain. But if you leave the plaque there long enough, it's going to cause damage. It's going to create pathogens, and it's going to lead to things that are not good for the body. That's where the simplicity of just fundamental oral health. If they didn't do anything else, just had their teeth cleaned periodically, by a professional. Okay, or do it at home. Because toothpaste today, they have abrasives in them. Some people like that. Some people don't like that. They have fluoride in them. Some people like that. Some people don't like that. But you can pick and choose. You can get baking soda. One of the best toothpastes is just sprinkle some baking soda. It doesn't taste very good. Okay, but it's a sodium bicarbonate. It's a base. It's a basic, so it neutralizes any acids that may be building in your in your mouth. Okay, so those are simple things. I want my profession to speak out more about. I'm an orthodontist. I want people to have straight, beautiful smiles. I do. But at the end of the day, I really want people to have good oral health, because good oral health is putting you in a position to have good overall health. And you can be working out every day, doing all kinds of things, have bad oral health, eating right, doing all the things, and have bad oral health. And you're going to lose, all of that hard work is going to go down the drain because you're competing against yourself. And again, I love the name Complete Human. It's about every part of the body. If you get an ingrown toenail and you don't attend to it, you could end up, if you have diabetes and you have poor extremity circulation, you could end up losing a toe or a foot or something. Everything matters. So, looking at the whole body is extremely important. I encourage my colleagues, I encourage my physician colleagues to pay more attention to oral health. And if nothing else, on their health history, have you had a dental checkup recently? Because that could be the motivation for someone to go see a dentist, and maybe be of value to completing that cycle of good, complete human health.
Wonderful.
And it seems like the straighter your teeth are, the easier they are to clean, which means maybe the better your health, which I like.
That there's two things. Okay. I think, I'm going to use, I'm an automobile kind of freakish person. Okay. I like that. When my automobiles are clean and they look good, I take better care of them. Okay. Now, maybe if you're not a car person, that doesn't make any sense. But if your teeth are in a better position, they're straighter, they're anatomically in a better position, you're going to take better care of your mouth because you see the value of that. Okay. There may be as much spent, and I don't know this for a fact, there may be as much spent on pedicures and manicures as there is on dental health. Okay. Because that makes people feel good. Okay. And I think it's important. Okay. Because if you have a cuticle that's overgrown and you don't push it back, you can run the risk of getting maybe more likely to have an ingrown nail or toenail or something. I don't know why I'm spending so much time talking about toenails. I should have been a podiatrist. Okay. So I'm just going to stop there. Okay. I'm going down one of my nerd holes.
We do that all the time over here. So before we jump into Candid and we'll kind of, that history, I have one final question. So, you go through orthodontics, you get a healthy mouth. One of the things that you said earlier was that we've got a softer diet. So if we really think about a diet in the form of oral health, both in preventing or maintaining proper orthodontic structure, as well as oral health, in your opinion, is there a evolutionary diet that makes more sense than the softer one that you kind of mentioned earlier?
Yes, there's an increasing number of pediatricians, pediatric dentists, and now sleep apnea providers. Okay, and those can be in medicine, and those can be in dental medicine. There's a lot of evidence point, and I'm not an expert in that at all. Okay, so I'm not gonna pretend to be. But yes, there are, and this would be someone good. One of my colleagues at Candid, Dr. Ben Moralia, he would be great for you guys to bring on to talk about this particular component, because he gives lectures and goes through some of the negative consequences of not shifting to a, let's say if there's no I'm just going to go into the superficial. If there's no breastfeeding, okay, and it's always bottled, and you go from there to Gerber, okay, or the soft foods, and you don't go into some more, I don't want to say tough, but firm things. Those help. Okay, like your bruxing is not necessarily good as an adult, but using your jaws and your teeth as a child into infancy and through adolescence, if you can get that going, back to the original question, it will help the oral anatomy to kind of kickstart itself and do what it's supposed to do. It's not completely self-correcting, but it's in the right direction. Okay, so if we can start getting this more into the mainstream for families and for parents, I think this could. It's not gonna stop my profession, okay, but it's going to keep us from maybe having to do a lot of things that we don't need to do. Early treatment is valuable. I really didn't like to see patients until about 7. And it had nothing to do with anything else other than they were just of an age where my personality could manage it. Okay, when I started dental school, I actually thought I wanted to be a pediatric dentist. My first, and it wasn't a pediatric patient, it was a 7-year-old female. I gave her a little injection as a dental student. She didn't say anything. These big old crocodile tears came rolling out of her eyes. I was like, negative. I cannot do that. That is not going to happen, because that is again, it just wasn't. It wasn't for my personality, because I'm a driver, and I'm kind of a type A, and I'm moving forward. And if I had to stop and deal with that every day, it would really be detrimental to my mental health. So I just didn't have, as they said in Apollo, I didn't have the right stuff to be a pediatric dentist. But orthodontist, starting at about 7, the American Association of Orthodontists recommends that's kind of your first trip to the orthodontist. If you've been going to a pediatric dentist, the pediatric dentist is going to be keeping an eye on this as well, and treating or making a referral to an orthodontist. So I hope I answered your question.
You did. Let's so thank you. And I think my takeaway from that is start giving your kids steak at the earliest of ages.